I'm Dr. Richard Gwines at Jackson Heart Clinic, which is at St. Dominic Memorial Hospital in Jackson, Mississippi. We're a private practice clinic in Jackson, and we're presently 13 cardiologists. After about 10 years in practice here, you definitely start to sense what some people term turnstile cardiology or turnstile medicine, seeing the same people come back again and again. And it was about this time, 6 or 7 years ago, that I really started spending more time learning about lifestyle medicine, reading several prominent authors, including Dean Ornish. My mother died of a heart attack at age 57 with sudden death for no obvious reason other than the standard American diet. So all of that got me thinking about why we're not doing a better job helping people stay well. And so we've got to make some changes clearly on the lifestyle side.
With the concern of health cost and the large incidence, particularly in this part of the country, of obesity, diabetes, and hypertension, we feel that it is even more important that we be involved with prevention and preventive programs, and lifestyle medicine is very important in doing that.
I've actually suffered 2 heart attacks. I suffered my first heart attack at the age of 20 and my second heart attack at the age of 21. And I had 3 cardiac caths prior to, well, around that time, in 1995. Found nothing wrong, no blockages, other than just myocardial damage. Fast forward to 2016, wanted the weight loss surgery, something wasn't right. They found a little bit of blockage and I ended up with a stent. And they said, hey, you want to do your regular course of action and just do the weight loss surgery, or would you be interested in participating in the Ornish program? And I said, let me find out a little bit about Ornish, and I like what I heard.
One of our amazing participants and now graduate, Gene, is a longtime friend of mine and an avid cyclist, and we've bicycled together for years, and he's a city leader not far from here where I live. And he's been a role model for our community. Despite his active lifestyle, and this would be a parallel to my own mother, despite a very active lifestyle and a love for being active and generally being thin and not smoking, one can still have heart disease.
The problem was, though, that I had a lot of other bad habits that I wasn't controlling, particularly stress. And also, of course, my diet. It was not anything for me to go and eat all the fried catfish I could hold or all the other products that weren't good for me. I have been motivated to be a part of the program because of several things. One is, obviously, is I have a lot of grandchildren, and the youngest one is 5 years old. And I'd like to be around a while to see them grow. I'm sorry.
Really, everybody should be considered a candidate. And it's kind of like I've done them a great disservice if I don't at least mention it. They've just had a heart attack, they're a little shook up, and what do I need to do, doc, to not do this again anytime soon? And most of them will at least listen to cardiac rehab, traditional cardiac rehab, the exercise component. And then I quickly build on, that's great, but I also want you to know about intensive cardiac rehab and what that is and how I truly think it's better gives you the tools to succeed.
Patients with coronary disease may take a statin, which does lower their cholesterol and improves their outcome, decreases the incidence of repeat heart attacks, etc. But it does nothing to address problems like obesity that are often associated with this, a syndrome called the metabolic or cardiometabolic syndrome, which is related to diabetes and hypertension and obesity. Lifestyle medicine addresses all of those problems.
I used to weigh 327 pounds. I think when I started the Ornish program, I was around 260, 280, and now I keep it in between about 215, 222 to 225. The reason why I failed so much in my previous attempts is that I did not incorporate the stress management. I didn't incorporate, the eating healthy as far as, eliminating a lot of the stuff that can contribute to the development of plaque and atherosclerosis. So the comprehensive approach of Ornish has just made this so much easier. I mean, the staff is so dedicated. They are here at at a moment's notice to answer any of my questions, and so I'm just over the moon about this program.
As a program director, I've got access to all kinds of outcomes. I can look at their cholesterol, I can look at what their hemoglobin A1C is, but from my seat as a program director, the most amazing thing to me is after a couple weeks in the program, I see people walking down the hall completely changed. Complexion has changed, a twinkle in the eyes. Even before things are reflected clinically, I can tell they're feeling better, and they start to notice it too.
Just changing my whole lifestyle has made a big difference, more than just the diet. I've learned to exercise more than just cycling, work on other parts of my body, my core. Obviously, stress release has been one of the biggest changes in my life. In my job, every day, there's plenty of things that happen that cause stress. And I have learned, maybe not 100% to control it, but I have learned to control it a great deal, and it's made a big difference.
So far, and we're well beyond a year, we're seeing the exact same data reproduced in Jackson, Mississippi that Dr. Ornish demonstrated in the research sites. So when I compare something on the lifestyle side that works well, that really the compliance is 85 to 90% compared to what we do with on the medication side, it really is astounding.
Everybody's got a different challenge. Some people start off with the, oh, well, I don't know if I can eat a vegetarian diet, but once they're eating the food they're providing and they're seeing things that are available that weren't available as products 20, 30 years ago, they think, oh, I can do this. One of the biggest changes has been those looking at the aspect of group support. They constantly go, well, I really don't want to share my feelings, and this is going to be awkward, but I'll just get through it because it's part of the program. But 9 weeks later, when they're graduating from the program, that's the part they miss the most.
How will Mississippians embrace a cardiac rehab program that's a bit more holistic with yoga and meditation and other kind of behavioral techniques, but have been completely blown away how well that's gone?
If you just focus on the process of getting better, the results will take care of themselves.
My wife is going through this program now also, and she's been very supportive. She's went through the program with me, obviously, on the meals, the diet part. Didn't understand all the other parts of it, but now that she's gone through it because of a heart attack of her own, it's become something of a team for us. And of course, a lot of our friends are seeing the change in our life, so they're asking a lot of questions and they want to know what we're doing, so that's been good for us.
I think that prevention and lifestyle medicine is definitely here to stay, and it's going to have to be a part of our future in healthcare delivery. But the rising cost of all the procedures and all the medications are going to dictate that we have to really get at prevention first. It just makes a lot of sense from several standpoints.
Understanding, cost associated with disease and understanding disparities that are associated with vulnerable populations of the state of Mississippi, I just don't think you can go wrong when you incorporate health in the everyday actions of people.
I told all of my employees that in Mississippi we're, macaroni and cheese is a vegetable and gravy is a beverage, that several years from now there's going to be a shift in the culture and the population. And while they may not see it while we're still employed here, we may be retired someplace, they'll be able to look back confidently and see that when Mississippi becomes a healthier state, that from what we did right here with Jackson Heart and St. Dominic's, that is what started that change in that right direction.
This program to me has been the biggest life change for me of anything I've ever been involved in.
It works. It's low tech, and it is very gratifying to see people's symptoms go away.